This video details what happens immediately before and the day of your heart surgery. If you want to hear about the pre-operation part of your surgery, please watch video 1 in this series. You will receive a letter from the waiting list office informing you of a provisional date for your surgery. Then, the day before surgery, you will be contacted again to confirm this date and tell you what time you need to arrive on the ward. When you arrive for your operation, you will be admitted to the day of surgery admission area. This is located on ward C708. We will prepare you for surgery and final checks will be made before we take you down to theatre. When you arrive in the anaesthetic room, you will be met by your anaesthetist and the theatre practitioners. They will attach monitoring leads, place a cannula in your hand, and you will have an oxygen mask placed over your face. You will then go off to sleep for the duration of the surgery. Cardiac surgery operations take approximately 4 hours. It may take longer if you are having complex surgery. Once your operation is completed, you will be taken straight to the cardiac intensive care unit whilst still asleep. You will have a tube in your mouth to assist with your breathing and lots of lines for monitoring. Your family can visit you when you arrive in intensive care, but you will be asleep initially, so please make your family aware that this should be expected. While you are a patient in the cardiac intensive care and high dependency unit, you will be under the care of a designated consultant anaesthetist and the specialist nursing team. They are very skilled in ensuring that you recover well. They are able to recognise and promptly treat any complications that you may experience. You will be woken up and taken off breathing support when we are happy that you are stable and able to breathe on your own. This may be a few hours after you return to the cardiac intensive care unit. Some patients take longer to recover initially from surgery and need more support. This is more likely if you have any other underlying health conditions. We will provide the individual care and support that you need until you have recovered from the surgery. If your recovery is straightforward, the nursing staff will help you get out of bed and sit in a chair on the morning after your surgery. This continues your recovery and helps your lungs expand, which reduces the risk of developing a chest infection. You will be reviewed by the consultant anaesthetist on the ward round. They will check that you are making good progress and that all aspects of your care are addressed. We'll check that you are comfortable and able to move and cough. It is important that you can stand and start walking as soon as possible after surgery. The nursing and therapy teams will assist you in doing this. Most routine patients require high dependency care for approximately 2 to 3 days after surgery, and you will be informed when you are ready to move to the cardiac surgery ward C708 to continue your recovery. To help you with pain management straight after your surgery, you will be given a pain relief device. This is called a patient-controlled analgesia. It consists of a button that you can press which will give you a controlled dose of morphine. If, after the ward round, you are doing well, we will move you into the high dependency area of the unit. You will remain under the care of the same specialist team, and we will continue to monitor you closely during the first few days of your recovery.